Welcome back to Healthwise. With us is Dr. Kerry Thibodeaux with the Wound Care Center of Opelousas. Doc, we were talking about what y'all do, and like I said, we've got a few minutes left, and I guess we want to also tell people, you know, we don't know what time we need to have wound care. I mean, it could be someone young, it could be, you know, I mean, that's another thing. I think there's this preconception that the only people that need wound care are older people.
Right, well, I'm glad you brought that up, because one of the things that we've been able to do in terms of physician ownership and managing this whole service line is that we're able to cross over barriers that might otherwise exist and do things like tell the emergency room doctor, if you have a wound problem that you see in the emergency room and you treat, you can refer them to us for follow-up rather than have them come back to the emergency room for a wound check. You know, when I first started practicing, it was very common to have patients come back to the emergency room for a check on a wound, a traumatic wound that they had. But as the emergency room volume has skyrocketed, and people are using it more and more as their only access to health care, it becomes very inefficient to continue to do that. So by reaching out physician to physician and telling the ER doctors, look, why don't you just follow up in the wound care center? One, now you've done the patient the best service you can by sending them to the best place they can go. And two, you've relieved yourself of all follow-up liability because you just told them where they got to go. and so in this era of practicing medicine, you can accomplish both goals there. One, avoid exposure for liability or criticism, and provide your patient with the best care. And when you provide your patient with the best care, everything else will take care of itself. And so we've actually then reached out to nursing homes and to even schools, school nurses, the kids that get injured on the school ground or show up at school with injuries. We get referrals from all over. And because we've been able to establish such a large footprint in the area, we pretty much have our referral system set up so that anyone with a wound who's not getting better has access to us, either through referrals or by simply calling us on the phone.
Okay. What about diabetes? What role does that play in the wound care?
Well, 20% of all diabetics in America will ultimately develop an ulcer of some kind or a complex wound of some kind. And once they develop an extremity ulcer like on the leg, they have a 20% chance of losing their limb, which is pretty significant, especially when you take into consideration the fact that amputation then shortens their lifespan, because 50% of amputated diabetics die within 3 years. So you are condemning them to a shortened life, and you're dramatically reducing their quality of life, and in some cases robbing them of their independence. And so our goal is to keep them ambulatory, keep them independent, and to keep them out of the hospital. And so our most challenging patients often are diabetics with other comorbidities, and yet our goal remains to make them whole and to reinsert them back into the fabric of their life and not rip them from it and have them be institutionalized and die prematurely.
Right. Well, Doc, like I said, we've got a couple minutes left. Usually at this point of the game, we ask the doctors to tell us a little bit about where they went to school and, something about personal. I already know Doc is a accomplished musician. He's in a group. He plays a lot of times at Willie's Campground, right?
Oh yeah, we play at Willie's, and we play for the festivals,
right?
And the cook-offs that we do, the rabbit and the squirrel cook-off, which people in this area support wholeheartedly. But my greatest accomplishment, my greatest job on this planet is being a dad. And my son Andrew, who's now 15, is really truly the apple of my eye. And at the end of the day, that's the one thing that I look forward to most, is taking off my surgery hat and putting on my dad hat.
Your dad hat. That's
yeah.
great.
And so to me, that's really what it's really all about, and the future, you know, and having conversations with your 15-year-old about this mounting debt and the overstretch of the government and everything is really unique. Something I never thought I'd be doing, and yet you have to have those conversations. You have to teach them to be able to deal with what's coming, and there's always been uncertainty in America, all the way back to the Revolution.
Sure.
But we've always been able to pull together and rise above it. I think at the end of the day, that's what will happen. But our children hold the future, and so if being a parent, if you are a parent, then it is truly your greatest job, and for me, the most satisfying.
Well, great, Doc. Well, Doc, like I said, it was great having you on the show. A lot of people have learned a lot about wound care. Opelousas and the surrounding area, y'all have a fantastic wound care center in Opelousas.
And they can reach us by calling the hospital directly.
Right.
So 948-3011 and ask for the wound center, and we'll be able to help.
All right. All right. Thank you for joining us on Healthcare. See you next week.
Healthwise is brought to you in part by Opelousas General Health System.